Good evening. I thank Mahila Samaj Manipal for giving me this opportunity to talk on dementia. Today is World Alzheimer's Day. In fact, today, every year, September 21st is celebrated mainly to create awareness about what is this Alzheimer's disease. So, this time the theme given is no dementia, no Alzheimer's. So, basically, they want to give information about Alzheimer's. You should know about Alzheimer's, you should know about dementia. So, dementia is a disease of the brain, and usually in most of the cases it occurs after the age of 65. Of course, there are rare cases of Alzheimer's disease itself which can occur at as young as 50, 60 and all. But most of the cases, most of the people develop dementia by the age of 65. So what is this? This is due to cell loss in the brain. Brain is made up of cells called as neurons, and as per research, they say as we age, the number of neurons starts reducing, and especially in people with dementia, the neurons start reducing fast. And there are different causes for this loss of neurons. Lot of things have been implicated. There are different causes of dementia. The most commonest cause is Alzheimer's disease. They say it is due to deposition of what is called as the amyloid plaques instead of these neurons. On these neurons there is this deposition of what is called as amyloid plaques, and because of which there is cell loss. So this particular cell loss can occur due to many other reasons like Parkinson's disease, Huntington's disease, head injury, because of excessive use of alcohol, because of vitamin B12 deficiency, because of folic acid deficiency. So basically this diagnosis of Alzheimer's disease is made out of exclusion. We don't say, if you really want to diagnose Alzheimer's disease, then the test is brain biopsy. Biopsy means taking a small piece of brain and studying it. That is not possible when you are alive. So we make this diagnosis of Alzheimer's out of exclusion. We rule out all other causes. So as I told you, the different causes of dementia start with all these vitamin deficiencies, head injury, hypothyroidism, hypoglycemia, low sugar level, so many things. So basically the symptoms of dementia are, these people suffering from dementia lose their immediate and recent memory. They are perfectly normal to look at. They will tell you about their past, they will tell you which school they studied, who were their close friends in school. But when you ask them what they had in the morning, they will not be able to tell you. They will be confused about day-to-day events. They will not be able to remember what breakfast they had. Then they will start misplacing things. They will search for keys in the fridge. They will keep the spectacles in the lower pocket and keep on searching for it. They will not be remembering who has visited them. So basically the problem is in immediate and recent memory. And slowly this becomes worse. And what happens is, these people, initially it starts with memory, then they start developing sometimes what is called as delusions. Delusions means false but firm belief in something which is not true. Like at the age of 80, a man may start suspecting his wife that she is having illicit relation with others. Or he may think that his wife is trying to poison him. He may think that son is going to harm him, son is going to take away the property and he will be thrown out. So these are called as delusions of persecution, delusions of infidelity. So these are wrong beliefs that start occurring, and as the illness progresses, they also start having hallucinations. They may start seeing people, they may say one child is playing in the house, they may say that somebody has started coming and observing them, They in fact look at their mirror and they are not able to identify themselves. They may identify it as somebody else and say somebody is a spy. So as this disease progresses, people lose their ability to control their urine. They develop urinary as well as fecal incontinence. So this is a disease which takes almost 15 to 20 years. Persons will be alive, but many a times they will become dependent on somebody. So basically, this is a disease which has no treatment. Let me be very frank. There are drugs which can slow down the progress of this disease. These drugs, now three main drugs that have come into market, we call them as cholinesterase inhibitors, donepezil, and of course there is a new drug called, new means the later addition is what is called as memantine. In fact, there was a lot of research going on in this disease in America, UK and all. Unfortunately, the funding on these drugs has reduced now. Otherwise, we would have expected many more drugs to come. But these drugs can only slow down the progress of this disease. And of course, certain behavioral symptoms in this disease can be controlled. That is, these false beliefs, delusions, hallucinations, all this can be controlled by medications. So basically, this disease requires a team effort, a psychiatrist, sometimes a neurologist, a good nurse to educate you, a good social worker to know your problems, and also to help you cope up with these problems. Many caregivers, they suffer from depression, they suffer from severe anxiety looking after these people with dementia. So basically, what you should understand is, if you want to control, if you want to see that you don't develop dementia, certain research points out that you should have very strict control of blood sugar, blood pressure, and you should spend at least 1 hour a day on walking. You should not drink, you should not smoke, and you should concentrate on your diet. A diet which is rich in green leafy vegetables, dry nuts, less of carbohydrates, eggs, fishes, meat. These are preferred over carbohydrates. So this sort of diet, they say, helps in reducing the in fact, increasing the time of onset of dementia. What I mean to say is, if you follow all this strict regimen, then instead of developing dementia at 65, you can develop dementia by around 75, 80. And in fact, as the age proceeds, 80, 90, there is no way dementia can be prevented. Most of us will develop dementia. So it's not a disease to be feared. We need to be educated about this disease. We need to work on this disease. We need to modify our lifestyle. And if your relatives are suffering, any one of your relatives are suffering, please take medical help. Please visit a psychiatrist or neurologist. KMC Manipal is well equipped with good services of neurologists and psychiatrists. So also hospitals like Mitra Hospital, AV Baliga Memorial Hospital, the government district hospital, there are services of psychiatrists. Please use these services. So I again thank the president of Mahila Samaj Manipal for taking keen interest in conducting a program like this. Thank you. Jai Hind.